Each state is supposed to establish and maintain one or more healthcare exchanges. The exchanges will be the marketplace for individuals and small employers to go for health coverage. The exchanges are supposed to be operational by January 1, 2014. If the state is unwilling or unable to have a state exchange up and running by that date, the federal government will step in and operate the exchange for the state. As we approach the fall of 2012, the majority of states will likely be unable to meet the January 2014 deadline. The healthcare exchange will offer 5 plans: the Platinum Plan, Gold Plan, Silver Plan, Bronze Plan, and the Catastrophic Plan, which is only available to younger individuals. If an individual gets his or her coverage through the exchange, the person will not be penalized under the individual mandate. The healthcare exchange will be open to almost all individuals and small employers. A small employer for these purposes means an employer with less than 100 employees during the previous calendar year. Prior to 2016, the state can limit the exchange to employers with less than 50 rather than 100 employees. And then, beginning with 2017, the state can open up the exchange to all employers regardless of size. It is one thing to have a marketplace for individuals to go buy the health coverage. However, if the people cannot afford the coverage, few will be able to use the healthcare exchanges. Therefore, the federal government is going to provide financial assistance to low-income individuals to help pay for the coverage. This assistance takes 2 forms. The first is premium subsidies, and the second is cost-sharing reductions. The availability and the amount of financial assistance is based on the individual's income. The more the person makes, the less assistance he or she will receive. The amount of federal assistance the individual will receive to buy health coverage through the state exchange is based on the person's income as compared to the federal poverty level. Healthcare reform says that if the individual's income is less than 133% of the federal poverty level, that person can enroll in Medicaid. If the person's income is between 133% and 400% of the federal poverty level, the person may be eligible for federal assistance to help pay for the health care exchange coverage. If the person's income is above 400% of the federal poverty level, he or she is not eligible for any federal assistance to help pay for the coverage. Finally, if the person is over age 65, he or she can get Medicare. Healthcare reform required the states to adopt uniform Medicaid eligibility standards. If a state failed to adopt those uniform standards, the federal government would withhold Medicaid funding. The Supreme Court ruled the federal government does not have the authority to force the states to adopt uniform Medicaid eligibility. This has created a glitch in the system. It is now possible for a person to earn too much money to qualify for Medicaid and also earn too little money to qualify for federal assistance to help pay for the coverage through the healthcare exchanges. It remains to be seen what will happen to those individuals. For those unfamiliar with the federal poverty level, this chart shows that in 2012, a family of 4 can earn up to $92,200 and still receive government subsidies through the healthcare exchanges. As you can imagine, this new subsidy will be available to a rather large segment of the population. Paying for these subsidies is a large part of the cost of healthcare reform. As I said, there are 2 forms of government assistance available to those who may be eligible, i.e., their income is between 133% and 400% of the federal poverty level if they go to the exchange to get their coverage. The first is a premium subsidy. The premium subsidy is used to reduce the maximum amount, expressed as a percentage of income, the person has to spend on healthcare exchange coverage. The lower the person's income, the smaller percentage of his or her income that he or she has to pay for the coverage. The second form of government assistance is cost-sharing reduction. All the plans offered through the state-run exchanges will be based on the High Deductible Health Plan, or HDHP, platform. In 2013, the maximum out-of-pocket under an HDHP is $6,250 for single coverage and $12,500 for family coverage. This means the annual out-of-pocket maximum for the plans offered through the state-run exchanges will be substantial. The federal government will help reduce the person's maximum out-of-pocket based on the person's income. It's very important to understand that this federal assistance, i.e. premium subsidies and cost-sharing reductions, are not available to individuals who have access to affordable, quality, employer-provided health coverage. The federal assistance also is not available to individuals who participate in the employer's group health plan, even if that coverage is not affordable. So, if the employer offers quality, affordable coverage to the employees, those employees can decline the employer's group health plan and go to the state-run exchange, but they will not receive any assistance from the federal government to help pay for the premiums or reduce the maximum out-of-pocket under the healthcare exchange's plans. The same is true if the person is actually covered under the employer-sponsored plan. That person will not be eligible for any assistance from the federal government to help pay for the premiums or reduce the maximum out-of-pocket under the healthcare exchange's plans. The following example shows how the federal assistance will apply. Mike and Carol are married and have one child, and their combined household income is $38,000 for the 2014 calendar year. This translates to 200% of the federal poverty level. Therefore, they do not have to pay more than 6.3% of their income for premiums under the healthcare exchange. Assuming the total annual cost of the silver plan through the exchange is $12,000. They only have to pay $2,394, i.e. 2% of $38,000 for the coverage, and they will receive $9,606 in premium subsidies. In addition, their out-of-pocket maximum will be reduced from $12,500 to $6,250. So they can receive up to $15,856 in federal assistance. Employers will be required to distribute a notice to all employees telling them about the healthcare exchanges beginning March 1, 2013. The government will develop the notice, but the notice has not yet been released. The initial enrollment period for the exchanges will be October 1, 2013 through March 31, 2014. The coverage will be effective January 1, 2014 for anyone enrolling during this period. There will be an annual open enrollment period each year beginning October 15th and ending December 7th, with the coverage effective date the following January 1st. Finally, there will be special enrollment periods when the person can get coverage through the exchanges. The special enrollment period will be 60 days beginning on the date of the special enrollment period event. This leads us to the third and final piece of the puzzle, the one that impacts employers, the employer mandate.